Hello guys, welcome to today's video. I'm here at the casualty unit of Mbale Regional Referral Hospital, and I'm going to give an update on the COVID-19 situation, but let me first get where to sit, and then I first share with you something. So this is the casualty unit of Mbale Regional Referral Hospital. Of course, this is the triage area. So yeah. Hello guys, I'm still at Mbale Regional Referral Hospital, where we have a treatment center or ICU for COVID-19 patients. And as I talk, the good news is no one is currently admitted in ICU with COVID-19. And this is what the WHO had to say, and of course this is what I've been waiting all along to hear from them, because we've been saying it over and over for those of you who have been following my COVID-19 updates on this channel. Now this is what they said on their Twitter handle. I'm reading this from WHO African region. It was posted 5 days ago, and this is what it was saying. Africa is facing its longest running decline in COVID-19 cases. Infections have dropped from a peak of over 308,000 cases weekly at the start of 2022 to less than 20,000 last week. Now, I have been saying that cases have totally decreased, and with Uganda, to be specific, we reported Omicron in December, and that was towards the end of 2021. So since we began 2022, we've seen that cases have rapidly dropped when Omicron came in. When you look at the vaccination, in March, Africa had vaccinated about 15% of the population fully. Those are the people who had received at least 2 doses of vaccines. So there is just a difference of 1 month between March and now, and it is not even a month because we have not yet completed April. So I believe I've not yet cross-checked with the data, but at this time I believe we have not doubled the other figure, because it took us a long time to reach 15%. So by now it is approximately 20% coverage. So with those low vaccination rates, we can't attribute the decline in this number of cases to vaccination. We are still performing very poor when it comes to vaccines. So I am not an anti-vaccine. As you all know, vaccines do a great job, and they have eliminated a lot of dangerous diseases like polio. We vaccinate for polio children, we vaccinate for hepatitis B, we vaccinate for TB, we vaccinate for whooping cough, for some pneumonias, and all those things. So, and even for cancers, we do vaccination for HPV. So I'm not against vaccination, as you all know, because I know vaccines do a tremendous job. What I'm trying to say is that we can't attribute the decline in the number of cases to vaccines, because the rates are not still convincing, but I attribute them to Omicron, because when you look at the statement that WHO published 5 days ago, it shows that the numbers of cases in Africa started reducing in the beginning of this year. And yet, to be specific, in Uganda we reported Omicron variant in December, and that is when cases started decreasing across Uganda, East Africa, and the whole Africa. When you look at the number of cases reported daily, even like in Uganda, yesterday they reported 4 cases, even Kenya only 4 cases. and in both countries I saw the positivity rate of 0.2%. So this shows that numbers have totally reduced, but our request was, since we can't attribute the decline to this number of cases to COVID-19 vaccine, of course it can partly be the reason, but still it is not convincing. So we were thinking that people have grown, like developed herd immunity. They have been exposed to Omicron and their bodies have created protection. That's why cases have decreased, and there's no need to add more vaccine if someone has gotten exposed and someone has recovered. Now, one of the reasons, of course, that's why people got exposed, Omicron, it was spreading very fast. That was causing mildly symptoms, but it could spread very fast. And of course, many people didn't have even protective gears. So many people were exposed, many people got sick, but they didn't get severe symptoms. And now more people have developed immunity, and we no longer detect a lot of cases. That is my submission. But if you have another explanation, please feel free to submit it in the comment section. Thank you very much. I'll see you in the next video. Bye.